Hi, welcome back to Roric Knows Best Podcast, helping you become a better and more informed you. Well, welcome to Dallas, Texas, and today I'm very pleased and honored to have Dr. Jeff Kinkle with me in studio. He's the chair of plastic surgery and the editor of Aesthetic Surgery Journal, the #1 plastic surgery journal in the world. So, Jeff, welcome.
Thank you. It's great to be here.
It's great. So, let's start off with overfilled and overdone. I mean, we see this day in and day out, and you know, do you think 2026 is going to be the year it's going to finally stop?
No.
Okay, we'll go on.
Yeah.
But I mean, at least people are realizing that it's not a good look. I mean, even the Kardashians are removing everything. You know?
Yeah. You know, I think the patients are becoming more savvy about what looks good, and they're not relying as much on the doctor telling them.
Right.
But I think, as you know, we have a lot of people who are providing, you know, injectable services, among many other things, that, you know, take a weekend course or aren't necessarily trained in it. And I think they get themselves into trouble.
Right.
And I incorporated ultrasound into my practice 3 or 4 years ago, really just to confirm anatomy in those high-risk areas. I don't use it on every patient, certainly, and I don't use it to inject.
Right.
But if I have a patient who's a secondary patient, or if I'm going to inject the nose or temple, or I just double-check where the blood vessels are. But there's just not a lot of people that have ultrasound. So I have started to see more and more of these patients who are having problems. And it's not just being overdone, but we know that in some areas of our face, it can have an impact on our lymphatic flow, and they can have chronic edema.
Yep.
And when I look in there with the ultrasound, there's no product there that I can see.
Right.
And they've already had, hyaluronidase multiple times by many other people. So it's not only this product that they're using, but I think it's the location that it's put, and in some patients, it's the damage that it's done to their lymphatic system or some of the anatomic structures that can be not only a long-term problem, but a problem forever.
Right, and it's really the tear trough area, right?
It's the tear trough area, it's the location, and probably the other thing is just choosing the wrong product for that area, right? Choosing a very hydrophilic product that is going to draw more water in and create more edema and inflammation, and maybe have an impact on the lymphatics as well.
Yeah, no, I agree, and I think, honestly, I've stopped injecting tear troughs. I use it fat, but I don't put fillers in there because it's just of all the things that you just talked about.
Yeah.
And I think ultrasound is very critical if you're going to try and remove it, because so many times I find it when I'm doing a bleph, they've injected into the rim, and it's in the septum, which of course you should never inject fillers there.
Right.
And so that's a real problem. And I tell you, it's very disconcerting. And I think the consumer needs to know that they need to know before they go. And also, they shouldn't be going to places where people are not trained or licensed. And they're all over. They're all over Dallas. They're all over the USA. And the oversight is so minimal. I mean, there's sometimes the physician, they're not even in Texas or even, not even in the US, I think.
Yeah.
And I don't know how they're doing it. I mean, you're jeopardizing people's lives, and it's crazy.
It is, and it's the same old story. Either it's a provider that they're seeing for some other health issue that's decided to do cosmetic medicine, or their friend went to this person's house and had injections and did really well.
Which is a real red flag.
Yeah, but I mean, you hear those stories almost every day, and you feel bad because then all of a sudden they get consumed with these problems.
Right.
And as you know, there's just some products, many of them, that we can't do anything about.
Right.
And then we don't even know what some of the long-term effects are of some of these inflammatory products. So I think the patients are getting smarter. I don't know if some of the providers are getting smarter. And so they're being a little bit more savvy about, number one, how much product to get, but then number two, who should do it.
Right.
Yeah.
Yeah, and I think that's some good advice for the viewer, Jeff, is that, they need to test the credentials. They need to say, who's doing it, what's your training, what is your accreditation, and let's look at that before you go and inject them.
Yeah.
And I think also they need to have a consult, rather than just say, I want 3 cc's on my lips.
Right.
I mean, it's crazy.
Yeah.
And I tell you, we're the ones who get to see those problems and then see them and get the calls at night. So where do you see the arena? I know you said no But I think people are getting smarter.
Yeah.
At least they're asking more questions.
Absolutely.
I mean, don't you think? And I see my patients, because you and I both, we never over-inject. We just actually say, hey, this is what you need. But we see those patients that have gone elsewhere and they come in with the big lips. I mean,
Yeah.
so what do you do? How do you counsel them? I mean,
Yeah, I mean, it's hard. You see a young woman who got her lips injected with multiple cc's, and, we can dissolve that, but when you put that much tension on soft
Right.
tissue, it's not going to bounce. I mean,
Yep.
the young patients can bounce back most of the time, but if they have it repetitively done, they're actually going to lose some elasticity and have an elongated lip or stretched out lips in other areas. So I think you just have to be real and candid with them and not throw anybody under the bus, but just say, look, it's probably going to be better for you to take a break, let all your tissues recover, then I'm happy to see you back, and then we can kind of reassess things. But, less is more is something that you always say, and I think it's so true here, right?
yeah, no, it's true. And then what about, we're going from the fillers to the biostimulators, which everybody knows is a good thing, but now we're in the era of regenerative medicine. So where do you, I mean, we've always, done fat grafting, which is the sine qua non.
Yeah.
But where do you see all of these other things that are happening? I mean, PDGF is here. It's really a regenerative medicine adjunct. And then what about the other techniques and technology? I mean, Renuva's been around for a while. It's donor cadaver matrix, and then there's some other new products that are on the horizons. Where do you see all that going? Because it's been very confusing in the literature.
It is.
Certainly on TikTok.
Which is the true literature.
Yes,
yeah.
exactly, yeah.
Well, I mean, I think there's many companies that are trying to develop products that can be used off the shelf to perhaps restore some volume, allow tissue integration, or what have you. And I don't have tons of experience with anything outside of Renuva, and I don't even have that much experience with that. We briefly mentioned exosomes before. I actually am super excited about exosomes because whereas fat and potentially, stem cells rely on injecting it into the host and then has to become viable before ultimately it can do something, and we don't really have a way to direct that. Whereas I think exosomes are going to be taken up by the cells and actually help signal what should be done. So I think I really think that's the next frontier. Is just further development, perhaps different DNA sequencing that we can use to rejuvenate or to prevent or what have you. And, I was in MCAS last year in Paris, and there was over 100 exosome companies there. So that muddies the water a little bit, and nobody has any objective data or science,
Of course.
But it's exciting. I mean, I think it's really exciting.
Yeah, no, it is exciting. And I think the human-derived platelet or the exosomes are probably got the most science.
I would think, yeah.
I agree. The plants, they may have some, but I mean, again, it's a really a good, and there's a lot of good science coming from the exosome. I mean, basically, they're the messengers for stem cells.
Yeah.
So it's kind of, it's going to tell the body what to do, and I think that makes sense. But regenerative medicine is certainly, people want that non-overdone look, and I think our job is to educate them, and I think that's a good thing to do. So Jeff, what would you, in closing, say, what would you tell the consumer and the viewer are the cardinal things that they should look for when they're looking on their pathway to getting a filler or, some type of biostimulator to help clear their confusion?
Well, I mean, I think first and foremost, most patients want to look like themselves. Right? Most. And
except if you're on TikTok. Yeah. Okay.
So if you go back and say, okay, you're 60 years old, when you were 30, let's just see what your volume looked like. I mean, and that can help them understand that, look, overdoing it is not going to make you look like yourself.
Exactly.
And most of our patients want to look like themselves. So I think that's important. I prefer some injectables over others, and that's just my preference, but it doesn't mean that the other ones are bad by any way. It's just what my preference is. So I kind of educate patients on why I like certain fillers in certain areas and what I think the advantages are, but tell them that there's certainly other ones that are out there.
But that's important because you are familiar and are expert at those fillers. I tell them the same thing. There's 20 fillers, but we use certain select ones. That's good.
That's right. That's right. And it's nice to have choices, but you keep in your toolbox, you keep the ones that are predictable for you in the different areas.
Right.
And, I like fillers that kind of go away over time rather than some of these more permanent options that have come out. I think the face is so dynamic, it changes, it fluctuates, and all of a sudden something that may look good may look horrible if you lose 10 or 15 pounds or what have you, and you have no way to really deal with it. So I think patients, for the most part, are pretty educated about this world, and they come in fairly knowledgeable. And I guess I'm fortunate. I don't see too many patients that want distorted appearances. And, as we talked about, being in practice now as long as I have and we have, it is easier to say no. And you still get fooled occasionally, but it is easier to say no and let them perhaps get another opinion.
Yeah, agreed. Incredible advice from Dr. Kinkle, a world expert in facial rejuvenation. And I think what he said is so true. It's, finding the right provider, finding the right person that's going to give you good advice, not do crazy stuff, and to use things that work, that are safe. So please give us your comments, give us your thoughts, and until next time, stay informed and stay safe. Thank you.